You've lived through decades of experience. You've known your body longer than most people have known theirs. But what if I told you that after age 60, what masturbation does to your body isn't what it used to be? In fact, some of the things you may think are harmless habits might be slowly harming your sexual health, circulation, energy levels, and even your confidence as a man. Today, I'm going to give you the truth, the facts, the medical insight that most men over 60 simply aren't hearing anywhere else. And it starts right now. Why this topic matters for men over 60? Let's be clear about one thing. Masturbation is not a bad thing. It's normal. It's natural. And for many men, it's one of the few remaining ways to stay connected to their sexuality in later life, especially if they're single, widowed, or struggling with intimacy. But as a urologist who has spent years treating older male patients, I can tell you this with confidence. Your body changes, your hormones change, and the way your body responds to sexual stimulation and recovery changes too. After 60, your testosterone levels are lower. Your blood circulation isn't as efficient. Your nervous system becomes more sensitive to stress. Your recovery time, both physically and emotionally, is longer. And so how you masturbate, how often you do it, and what happens afterward, these things start to matter more than ever. In this video, I'll walk you through what exactly masturbation does to your body after age 60, how it affects your prostate, testosterone, and erections, the surprising mental and emotional effects that most men don't talk about, and what science actually says about the right frequency, technique, and timing. Whether you're still regularly self-pleasuring or just curious if your habits are helping or harming you, this information is going to give you a new level of awareness and control over your health. What really happens inside the body after 60? Let's start with the basics. When a man masturbates at any age, his body goes through a natural cycle: arousal, stimulation, climax, and recovery. But after 60, each phase of that cycle begins to behave differently than it did in your 30s or 40s. Testosterone levels are lower and more sensitive. By the time you're in your 60s or 70s, your body naturally produces 30–50% less testosterone than it did in your peak years. That doesn't mean you're broken. It means your body is adjusting. However, low testosterone, also called low T, affects everything related to masturbation. It takes longer to get aroused. Erections are less firm or reliable. Sensitivity decreases. Orgasm might feel less intense, or shorter recovery time increases. That means your body needs more care, not just more stimulation. Circulation becomes slower and less efficient. Erections require strong blood flow to the penis. Plain and simple. As you age, arteries stiffen, blood vessels narrow, and circulation efficiency drops. That's why many men over 60 begin to experience delayed or partial erections, loss of firmness, more difficulty finishing, or needing more time and more stimulation to achieve climax. And here's the truth. Masturbation doesn't fix circulation problems. It reveals them. If you're masturbating and struggling with response or recovery, it may be a red flag that your cardiovascular system is slowing down. The brain's reward system is more vulnerable. Dopamine is the brain's pleasure chemical. Every time you climax, dopamine spikes. But in older adults, that spike is often shorter, weaker, and less satisfying. Why? Because aging affects the brain's reward response. Over time, if you're using masturbation to escape boredom, anxiety, or loneliness, your dopamine system adapts, meaning you might need more stimulation to feel the same result. The high doesn't last as long. You may feel emotionally flat or even a little guilty afterward. This is why some older men describe a sense of emptiness or emotional drop after solo activity, especially when it's routine or disconnected. Prostate health comes into play. Here's where things get more medical. The prostate, a small gland below the bladder, plays a key role in ejaculation. And for many men over 60, prostate enlargement, BPH, is already happening. Masturbation can stimulate the prostate, temporarily relieve fluid buildup, but also trigger inflammation if done too frequently or aggressively. If you're noticing post-ejaculation discomfort, dribbling urine, pelvic tension, or pain in the lower abdomen, then your masturbation habits may be interacting negatively with your prostate condition. This is something you should discuss with your doctor, not ignore. Your recovery time is longer, and that's okay. In your 20s, you could climax and be ready again in 15 minutes. After 60, it might take hours or a day to feel reset. That's not a sign of failure. It's a biological truth. During recovery, your nervous system shifts into parasympathetic mode, the resting phase. This is when your body rebalances hormones. Blood vessels return to normal. Your brain starts to shift away from sexual focus if you interrupt this phase by rushing back into stress, activity, or overthinking. You disrupt your own natural balance. Emotional and psychological effects of masturbation. After 60, why this is often ignored. Most health discussions around masturbation focus on physical effects, erections, testosterone, circulation, prostate. But for many men over 60, what happens in the mind and emotions can be just as important, and in some cases, even more impactful. Whether you masturbate once a day, once a week, or only on occasion, the emotional after effects can surprise you, especially if you're navigating life transitions like retirement, divorce, or widowhood, loss of libido, loneliness, or emotional isolation, chronic stress, or health anxiety. When guilt and shame, the silent saboteurs. Many men grew up with cultural or religious messaging that masturbation is dirty, sinful, or immature. Even after decades, those beliefs don't always disappear. You might not say it out loud, but deep down you may still feel embarrassed about the habit, ashamed after climax. Too old to still want sexual release, or worried that something is wrong with you. This quiet guilt can lead to avoiding intimacy, lowered self-esteem, anxiety about being caught, or treating masturbation like a secret rather than a healthy act of self-care. Important truth. You're not broken, weird, or doing anything wrong. Science and modern medicine supports masturbation as a normal, healthy behavior in all phases of life, including after 60.2. Emotional flatness or post-climax drop. After orgasm, your body naturally releases dopamine and oxytocin, feel-good chemicals. But in older men, the dopamine rebound tends to be shorter and sometimes weaker. That's biological, not personal failure. You might notice a sudden emotional drop, feeling empty or disconnected, a desire to isolate, irritability, especially if you're already under stress. Many men confuse this with regret, but in reality it's your neurochemistry resetting. Tip: after masturbation, instead of rushing back to your to-do list or checking your phone, try sitting in silence for a few minutes, taking deep breaths, reconnecting with your body in a calm way, journaling, stretching, or walking. This helps your brain reintegrate the experience, instead of pushing it away as something weird I just did alone. 3. The role of loneliness and emotional isolation. For many older men, especially those living alone, Masturbation can become more than just a physical release. It becomes an emotional crutch. That's not inherently bad. In fact, it can offer comfort. But if it's the only form of intimacy in your life, it can also deepen feelings of emotional numbness, disconnection from others, avoidance of vulnerability, or reinforcing the idea that I don't need anyone else. Sexual expression is natural, but so is connection. If you find that masturbation makes you feel more alone, not less, it may be a signal that your body is asking for more than just physical release. It may be asking for companionship, physical touch, honest conversation, or emotional healing for positive psychological effects when done mindfully. It's not all downside, far from it. Masturbation after 60, when approached with intention and care, can help you feel more alive and in touch with your masculinity, relieve stress and anxiety, improve body confidence, boost mood and sleep quality, provide a sense of control over your health and pleasure. The key difference? It's not the act itself. It's how you frame it in your mind. When you see masturbation as a form of self-care, a way to honor your body, a tool for healthy aging, it becomes empowering, not shameful. Science-backed advice on frequency, technique, and timing. After 60, why this part matters. One of the most common questions I get from older male patients is, "Doctor, how often should I be masturbating at my age?" It's a valid question, and there's no one-size-fits-all answer. But here's what the science and clinical observations suggest. How often is too often after 60? Most healthy men over 60 can safely masturbate anywhere from 1 to 5 times per week, depending on physical health, especially cardiovascular function, libido and arousal patterns, energy levels, and recovery, emotional, or relationship dynamics. There's no universal right number, but here are a few key signs you might be doing it too often. You feel more tired than energized afterward. Erections are getting weaker or less consistent. You notice pelvic discomfort or soreness. Your interest in partnered intimacy is decreasing. It feels compulsive rather than intentional. If any of those sound familiar, consider cutting back and giving your body time to reset. Technique. Gentle wins. Over force. Another overlooked aspect of healthy masturbation is how you do it. As sensitivity decreases with age, many men unknowingly apply too much pressure or speed to try and compensate, which can lead to nerve desensitization, microtrauma to the penile tissue, delayed ejaculation, or even erectile dysfunction over time. Doctor's advice: use a water-based lubricant to reduce friction. Experiment with slower rhythmic motion instead of fast or aggressive movements. Stimulate different parts of the shaft and glands. Not just one area. Use both mental imagery and touch to stay connected, rather than zoning out. Think of it like stretching or yoga for the nervous system. Mindful, controlled, and nourishing, rather than rushed. When you masturbate matters. Timing of self-pleasure can greatly affect how your body responds, especially after 60. Best times to masturbate: late morning or early afternoon when energy and testosterone are naturally higher, before a shower or nap to promote relaxation and circulation during low-stress periods, not when you're angry, anxious, or exhausted, times to avoid. Right after a heavy meal. Digestion draws blood away from the pelvic region late at night if you suffer from insomnia. For some, it can disrupt melatonin production when you're emotionally triggered or seeking escape. This reinforces negative habits over time. Remember, masturbation should energize or ground you, not drain you. If you feel worse after, physically or emotionally, that's a signal to change your rhythm. What the research actually says: Here's what modern sexual health studies have found regarding aging men and masturbation. Regular ejaculation, 2-4x per week, may reduce prostate cancer risk. Solo activity helps maintain erectile function by promoting blood flow. Mindful masturbation can support neuroplasticity and dopamine balance, excessive, aggressive, or compulsive. Masturbation is linked to erectile difficulties, emotional numbness, sleep disturbances, even cardiovascular strain in men with pre-existing conditions. So yes, the science supports masturbation in later life. But it must be practiced with awareness, balance, and intention. Common myths about masturbation, after 60, debunked even in the age of modern medicine. Misinformation about masturbation continues to circulate, especially among men over 60. Some myths come from outdated science. Others are rooted in cultural or religious beliefs, and some are just plain wrong. In this section, I want to clear the air, so you can make decisions based on facts, not fear or shame. Myth 1. Masturbation causes erectile dysfunction. ED. The truth: masturbation, when done moderately and mindfully, does not cause ED. In fact, it can help preserve erectile function by maintaining blood flow to the penile tissue and keeping the pelvic muscles active. The real problem comes when men rely too heavily on porn or extreme stimulation, use excessive grip or speed, or develop psychological dependency that disconnects them from natural arousal. These behaviors can lead to situational ED, but masturbation itself, in a healthy context, is not the cause. Myth 2. Masturbating after 60 is sad or shameful. This is a cultural myth, and it's one of the most damaging. Older men are often portrayed in media as asexual or past their prime. That leads many to believe, I shouldn't need this anymore. It's embarrassing to still want sex. If I'm not with a partner, I must be doing something wrong. But the reality is this: sexual desire does not have an expiration date. Masturbation can be a normal, healthy expression of connection with your body, regardless of age or relationship status. Myth 3. It weakens the body or drains vitality. Some men worry that ejaculating too often will deplete their strength or lead to muscle loss, fatigue, or hormonal imbalance. The truth: there's no scientific evidence that masturbation weakens physical strength or uses up sexual energy, unless it's done in excess without proper rest and nutrition. In fact, masturbation can reduce stress, improve sleep, help regulate testosterone, lower blood pressure, and improve mood. Balance is the key, not abstinence. Myth 4. It's only for men who can't get a partner. Many older men believe that masturbation is something you only do if you're single or unwanted. But that's simply not true. Surveys show that even men in happy, healthy relationships still masturbate, sometimes as a supplement to intimacy, and sometimes as personal self-care. It's not a reflection of failure. It's a tool for understanding and managing your sexual needs in a private, pressure-free way. Myth 5. It doesn't affect health, so it doesn't matter. Some think it's just a private act. Why even think about it? But as we've covered, what you do with your body, especially regularly, always matters. Especially after 60, masturbation can impact circulation, prostate health, mood and hormone balance, sleep, self-image, just like diet, exercise, and rest. How you handle your sexuality is a pillar of health. Practical tips for healthy masturbation. After 60 by now, we've talked about the biology, the psychology, the myths, and it's clear that masturbation, when approached with care and balance, can be a valuable part of your overall health routine. But the key to doing it right isn't just knowing the what, it's knowing the how. Shift the mindset. From habit to intention, one of the most powerful shifts you can make is to stop treating masturbation like a reflex, something automatic or mechanical, and start treating it as a form of intentional self-care. Ask yourself, do I actually feel desire right now? Am I doing this out of habit, boredom, or stress? How does my body feel today? You don't have to overthink it, but by being present and intentional, you can dramatically increase pleasure and reduce guilt. Always use lubrication. This can't be overstated. As you age, the skin on the penis becomes thinner, drier, and more sensitive, especially if you're on medications for blood pressure, diabetes, or prostate issues. Using a good water-based or silicone-based lubricant reduces friction, protects the skin, and enhances sensitivity. Bonus tip: some lubricants contain aloe vera or vitamin E, which can actually nourish the skin. Engage your whole body, not just one area. One of the most common mistakes, especially in older men, is becoming too narrowly focused on one area or technique. Instead, try changing your rhythm, stimulating different areas, base, shaft, perineum. Engaging your breath, which helps regulate the nervous system, using touch on the thighs, chest, or neck to awaken full body sensation. Masturbation can be more than release. It can be a way to feel more connected to your entire body. Give yourself time. Before and after, don't rush it. Treat masturbation like you would a walk, a bath, or a massage. Something you prepare for, engage with, and recover from. Tips: find a quiet, private space. Relax your body first with deep breaths or stretching. Afterward, rest for a few minutes. Let your nervous system settle. Avoid jumping right into stress, email, news, to-do lists. Think of this as sexual hygiene, a complete cycle that honors your body. Practice aftercare. Aftercare is simple, but most men skip it. After masturbation, wash your genital area gently with warm water. Pat dry. Don't rub. If the skin feels dry or irritated, use a fragrance-free moisturizer. Clean any devices or toys thoroughly. These small habits prevent irritation, infection, and reinforce that your body is worth caring for. Tune into your emotional state. A lot of men over 60 are surprised when I ask them, how do you feel after you masturbate? If the answer is drained, disconnected, or embarrassed, that's worth noticing. You might be using it as a coping mechanism for something deeper, needing more social or emotional intimacy, or ready to explore partnered intimacy. Again, masturbation can be a check-in, not just a release. Match frequency to your energy and recovery. There's no perfect number of times per week. Some men feel great after 3 times a week. Others feel best at once a week or less. What matters is, do you feel energized or depleted after? Are your erections still responsive? Are you looking forward to it? Or just repeating a habit? Listen to your body. It knows more than any number. Final takeaways and encouragement. If you've made it this far, I want to thank you. Because this topic, even today, still makes a lot of men uncomfortable. And yet, it's one of the most important conversations we can have about men's health. After 60, we've covered a lot, so let's bring it all together. What you now know. Your body changes after 60, hormonally, emotionally, and physically. That affects how masturbation feels and what it does to you. Masturbation isn't shameful, weak, or wrong. It's a normal part of being human, even in your 60s, 70s, or beyond. Mistakes happen when it's rushed, habitual, or aggressive. These lead to fatigue, numbness, or emotional disconnection. Balance and technique matter. Mindful, gentle, well-timed self-pleasure is not only safe, it can improve circulation, reduce stress, support prostate health, and preserve confidence. You have more control than you think. By tuning into your body's needs, not just your old habits, you can make this part of your life feel vital, empowering, and healthy. A message to men over 60: you are not past your prime. You are not invisible. Your body still deserves pleasure, care, and attention, and just like with nutrition, sleep, or exercise, how you engage with your sexuality becomes even more important as you age. So let go of guilt. Let go of the myths. Let go of anyone else's judgment, and start giving yourself the same respect, patience, and care you've probably given to others your whole life. Final advice: as a doctor, masturbation can be a form of emotional release, a practice of connection, a health-maintaining activity, or simply a quiet moment of comfort in your day. What it becomes depends entirely on how you treat it. If this video helped you, or gave you a new way to think about your health, please consider subscribing, liking, or sharing it with someone else who may need it. The more we talk about men's health without shame, the better lives we all live together.